So good day everyone, I'm Alche, Gamposilao, level 3 nursing student from Davao Doctors College Incorporated. And I'm here in front of you to return demonstrate the first aid applying a rigid board splinting. But before I start my demonstration, let me first give an short overview of what is first aid rigid board splinting and its importance. So a brief overview, first aid is an emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. Applying a rigid board splinting, any rigid objects such as wood or plastic, boards, broomstick, book, or rolled up newspapers, which can be used to split a fractured arm or leg. Flexible splint, any flexible object like a pillow or bedsheet with several folds can be used. So to start, let me show you the materials that we'll be needing for first aid rigid board splinting. So first material that will be needed is rigid board. This is our rigid board. Or if not available, you can use this like flat cartoon that can support the broken arm of the patient. Next is you need an triangular bandage. If you do not have triangular bandage, you can use any cloth or long handkerchief that can serve the purpose. Also, lastly, the gloves. So first procedure, prepare necessary equipment like rigid board, triangular bandages, and at least 2 or any cloth that can serve the purpose. Rationale for this is the rigid board. The purpose of this is to help prevent an injured body part from moving, while the 2 triangular bandages, it is used for dressing, and it is also used as a sling to support a fractured limb. So next step is check if the scene is safe. There are 4 things that we need to consider in checking if the scene is safe. First, you need to check for unusual noises. Next is you need to check for unusual sight. Next, you need to check for unusual odor. And lastly, you need to check for unusual appearances. Our rationale for this is to ensure that the safety of our patient and also to prevent harm to ourselves and to the other rescuers. So, I think the scene is safe and we're good to go to the next step. So, next step is you will need to get a consent. Rationale for this, it is important to get consent from the patient because patients have the right to make an informed decisions about their care and treatment. Today, ma'am, I am Gamposilao, student nurse and also first aider. May I help you, ma'am?
Yes, please.
Or alone, you can speak to the patient, ask the patient to hold or support this part. Ma'am, pag-ihawit ko din na part. So next step is you need to check for circulation, check for feeling or sensation, check if the patient's fingers can be moved, also check for warmth, if patient's in the injured part is warm, also check if the pulse is normal or abnormal, also check for color, check patient's skin if it is pale, because if it is pale, it indicates an impede circulation or obstruction of circulation of the blood in the injured area. Also, if pinkish, it indicates a normal circulation. So rationale for this is it is essential to check for this is to ensure that will be an adequate perfusion still reaches to the affected extremities. So for the next step is you need to place an appropriately sized rigid splint, example our padded board, under the injured body part. Rationale for this is in order to support injury and prevent further damage. So I'll be getting now a rigid board to apply to the patient's broken arm. I'll be applying to the patient's broken arm the rigid board. And ma'am can ask the patient to support the rigid board. Ma'am, can you support the rigid board is applied on the patient's under the patient's injured The next step is you need to secure bandages. First is tie several folded triangular bandages or any available cloth above and below the injured body part. So now I'll be putting the bandage first on the above area of the impede part. So make sure to make the knot in the splint side so that you will now not impede the circulation of blood. Next is ask the patient to support this area while you tie above the injury. It should be wrapped completely around the splinted extremity to secure the splint, but it should not be too tight as to block the circulation. So, ma'am, support ko ma'am. Next is I will put the second bandage in this area, below area, and I'll be doing the same thing as I do on the first bandage. So I'm done. So next step. So after securing the bandage, we need to recheck for circulation. So we need to check for feeling, check for warmth, and check for color. Rationale for this is to guarantee that the bandages are not too tight to block or impede the circulation around the injured area, circulation of blood. So first, I'll check in the feeling. So ma'am, di kay good ma'am. So kumina ma'am. Okay ra. Malok may mong kamot ma'am. Yung fingers. Malok may ma'am. So I'll be checking also for the warm. So I'll be also checking the color and also the pulse. Color is not pale. It's pinkish. And so last step is we proceed to the nearest medical facility or hospital. After checking for the circulation of the patient she is now ready to be transported to the nearest hospital. This is important so that the patient can have a checkup like diagnostic tests and follow-up checkups, and also to be given a proper medical attention.